Have you ever wished you could find a doctor you feel totally comfortable talking to about every aspect of your health, especially during the menopause transition? Someone who not only understands the science, but who truly gets what you're going through on an emotional and personal level? Well, I've found her. Today, we're going to meet Dr. Jessica Shepard, the girlfriend doctor we all need. Welcome back to Pleasure in the Pause, the podcast where we empower midlife women to reconnect with their bodies, pleasure and power in perimenopause, menopause, and beyond. I am your host, Gabriella Espinosa, midlife and sexual wellness coach, and it is my pleasure to be here with you. Dr. Shepard is a board-certified OBGYN, menopause expert, and women's wellness advocate with a holistic and balanced approach that I absolutely love. In today's episode, we dive deep into emotional wellness during the menopause transition, discussing what is actually going on when we're experiencing the roller coaster of emotions and just not feeling like ourselves. Dr. Shepard offers her practical insights and a roadmap for thriving emotionally through menopause by embracing a 360-degree holistic approach which combines the best of Western and Eastern medicine. We also talk about her new book, Generation M, which I'm thrilled to have in my hands. It's the ultimate girlfriend's guide to menopause, packed with Dr. Shepard's expert guidance and featuring contributions from leading voices, including yours truly, on the benefits of breathwork and yoga practices for managing stress. This book is your companion to navigate perimenopause and menopause with confidence, vitality, and pleasure. You've likely seen Dr. Shepard on platforms like The Today Show, Good Morning America, or read her insights in Forbes, Vogue, and Women's Health. I know you're going to fall in love with Dr. Shepard's compassionate and practical approach, just as I have, and see her as the guide you need for the life you want. Without further ado, let's get into this insightful conversation with Dr. Jessica Shepard. Welcome, Dr. Shepard.
Thank you so much, Gabriella, for having me. I'm so excited to be here, and I'm so glad that you have taken this step to do exactly what you want to do and sharing it with others.
Oh, thank you so much. You and I met a couple of years ago now in New York City at a menopause symposium where you spoke. And I just loved your holistic and no nonsense approach to menopause. You just laid out this very helpful menu of medical options, holistic lifestyle solutions to manage menopause. And I feel like in a time when the menopause conversation can feel so polarizing and confusing, your perspective is so refreshing. So thank you so much for this. You advocate for a balanced medical and holistic approach to menopause. So can you elaborate for our listeners why you choose this approach and how does this exactly translate when you are working with clients in your clinical practice?
Yeah, I'm so glad we started out there because I think, for 15 plus years, I was in academic medicine, which is really like the heart of traditional medicine and where patients come to you because they have an issue and we're able to prescribe or give them a medication and or recommend a surgery. Now, I would say after 15 years, what I really realized being in a room or an OR or even a delivery room when I used to deliver is that behind every woman's I guess you could say visit was so much more than just the visit. It was the emotional aspect. It was the relationship aspect that they had with their family, friends, or partner, etc., or just how they were feeling that day. And so I felt that there's so much more to our health than just for the reason that we came in for. And as I started to explore, maybe about 7 years ago, and I've always believed in holistic health, it was something that was always a very big part of me, is how can I, as a provider, really give back to patients in a way that they can kind of see their lives in a different light other than just being ill versus well. There's so much more in between. And I think that's really where holistic health comes into play is what are the things that I can do, I kind of say, that are the homework, the things that I can do outside of the exam room, outside of the OR, outside of a delivery room, in every aspect of my life through lifestyle med, through mindfulness, that can also contribute to my overall health than just going to the doctor. And that's kind of where it started. And then fast forward to 2020, when I left academic medicine and started what I have now, which is Sanctum Med and Wellness, which really looks at the blending of Western medicine, Eastern philosophy and modalities in order for people to reconceptualize how they view their life and what they can input into that.
So creating new models of looking at our health and well-being. I love this 360-degree approach. It's not sort of an either or, but an
Yeah.
and
Mhm.
really calling forth or calling in a lot of these holistic practices that science or medicine necessarily hasn't proven to be
Mhm.
true, but that we know, right? We know are so beneficial to us. And I love that if anyone looks at Sanctum Med, your website, so beautiful. Just the whole menu of options from yoga to nutrition to coaching, which I feel is so important. It's
Yeah.
not just about looking at what's wrong with the person, but looking at what's whole about the person. And I love that about your approach.
Thank you.
I wanted to move on and talk about something that doesn't get enough airtime in the menopause discussion, and that's emotional wellness.
Mhm.
Yet so often we are so floored by or caught off guard with anxiety that comes out of nowhere, bouts of rage and anger, low mood and depression, grief and sadness at the realization that things are no longer like they used to be. And I
Mhm.
hear so often, time and time again, I just don't feel like myself anymore from the women that I coach. Can you explain to us what is happening to us at a physiological level when we're dealing with this whole cocktail of
Yeah.
emotion?
Yeah, this shift or this transition, as I like to call it, of menopause for so many years, decades, and we're coming out of that right now, but I do think we have a lot of work to do, is we've given it this kind of black cloud, Debbie Downer type of
Mm,
in your life that people are scared about. And so I think that one, we need to change that narrative, right? I think that you do that beautifully and really kind to redefine who you are as a person and not focusing so much on the things that are changing physiologically and obviously have some side effects and symptoms. But how do we work ourselves into this, again, very biological process that will happen to every woman from a different perspective? And then the other thing that I would, start out with when we think of emotional aspect is that menopause has been a lot of times just hyper focused on the pelvic area because, those reproductive organs are there. But what we've started to see, and even, kind of going to the book, The Menopause Brain with Dr. Lisa Mosconi, is that actually there are so many body organs and systems that are impacted by menopause, in addition to your reproductive organs, namely the ovaries. And so
mm,
think about that. There are changes to the brain that occur because of menopause. And that in turn impacts the neurotransmitters, memory, the actual structure of the brain. And then again, like we just said, how we feel emotionally, how we actually are able to take that in, process it, and then actually make some of the subtle changes that in turn help our mood. And so I think that it's important for women to really hear that you're going to see how menopause over time impacts gut health, your bones, your brain, your heart, in addition to obviously your reproductive system. And once we really conceptualize that it's a whole body transition, I think that we will have more grace with ourselves, be more aware and understanding of those changes and how the decrease in estrogen is going to interact deeply with some of the brain neurotransmitters, namely your serotonin, your GABA, your glutamate, and your dopamine, which again, before has done this really good job at balancing our mood and how we feel emotionally. And so when we know that this is coming or may happen during this transition, I think that gives us a better landscape to say, how would I like to land on these things when they start to occur? But for so long, we never talked about menopause. We never talked about the symptoms. And it was almost as if we were waiting for someone to hit a brick wall and then being like, "Oh, yeah,
mm.
these things are gonna happen." I'm much more, and you'll see this throughout my book, Generation M is looking at how do we create kind of this pathway, welcoming women into perimenopause and menopause, helping them understand the process better, and having a holistic look at it so that we are doing some lifestyle changes as we start to get there rather than waiting for the train to crash.
Yes, and that hitting that brick wall is so familiar, right? I often say I was left totally in the dark when I hit perimenopause and just these symptoms coming out of nowhere, not having any kind of understanding or language to describe what was happening. And we can spend so much time in that phase, right? In that perimenopause phase, what I call that in-between phase of who we used to be and who we're becoming. And it's almost like finding a new identity for ourselves. And this uncertainty can trickle into so many aspects of our lives, our sense of self, our work, our
Mm.
relationships, our sexuality. So, what advice do you have for our listeners who are just embarking on that perimenopause phase or maybe are not there yet? What can they do to prevent that running into that brick wall?
Yeah, first of all, setting the stage again, like I said at the beginning, is I always say this: we've created this screenplay, if you would, of menopause being a very horror story type screenplay, and I'm really trying to push it over into the narrative of a comedic love story, where, as you just said, giving ourselves the opportunity to rediscover, explore who we are as we start to go through these changes, but also particularly paying attention to what are the things that for us individually are the most, I guess you can say, obvious side effects and symptoms. So I really double down on that with my patients when I'm going through menopause or perimenopause consults is what are your top 3 things that are happening to you? Because when we look at the symptoms of menopause, there are over 34 symptoms of menopause. And so some people will have 1 to 5, some people will have 10. And then also severity and frequency. How do those factor into it? So it's kind of like taking account for yourself and also being very body aware because as you start to see these changes, we know our body best, right? And so I think that it's taking notes. But in order to take good notes, we have to have good information. And that's why these conversations that we're having are so important because it allows people to be like, oh, I didn't realize that that thing that was happening, whatever it might be, could be because I'm going through perimenopause. Whereas a lot of people kind of suffer in silence, I would say, is where they know things are happening, but they don't quite know how to address it. And then they don't know what it's connected to. Or worst case scenarios, they do discuss it with a healthcare provider and they're kind of tried to gaslit in a sense where they're trying to convey that it's not really happening. And so I've seen a lot of that as well. But I will say we did not have a very good understanding when we think of the healthcare side of it and healthcare professionals and research into all these different little nuances of menopause and what it's causing, across the body. So we're getting to that point where we have a lot more data, but now it's getting it to the actual audience, which is all the women in the world. 6,000 women a day are entering menopause, right? So we have a lot of women to get this information to.
And for some of our listeners who may be in that place where they're starting to experience the sort of the emotional roller coaster of menopause, that low mood or that anxiety, the sadness or the anger, the rage that comes up, what tools do you offer them and what role can menopause hormone therapy play in helping with that?
Yeah, I'll look at that in kind of 2 buckets. I would say in lifestyle modification and behaviors and holistic
Mm.
ways that you can really modify some of those changes, mood wise or behavioral, is through, which you know very well, is through mindfulness,
Mhm.
the power and strength of meditation and or yoga or together. Even practices such as like what we offer here at Sanctum is vibrational sound bath. Really
Mm.
using the resonance of your body and tones and vibrations to kind of set who you are and really redirect any things like depression and anxiety. And then also things such as therapy. I think talk therapy is also important for you to really verbalize the changes that you're going through so that you're aware of them. And I think that acupuncture also is a beautiful way that can help with that as well. And so then when I look at the other side of hormone replacement therapy or menopause hormone therapy, is that HRT or MHT really has the ability to, again, redirect the decrease of estrogen that is occurring naturally and does affect our mood and influences serotonin levels and the serotonin receptors and modifies those endorphin levels, the feel good chemicals, is that the use of HRT is really going to give the body's connectivity and I guess you can say communication with neurotransmitters it back. It's going to have that impact and I guess represent the modification or the maintenance of what it used to be before it was in that severe decline. So again, estrogen has so many different utilizations and it has so much benefit at different parts of the body. You have estrogen receptors on your brain. They interact with neurotransmitters. And so being able to modulate those with HRT is also a beautiful way to see some of the, I guess you can say, impact or improvement in things such as anxiety and depression that have been shown to increase during the perimenopause and menopausal phase.
And how do you help a woman make the decision for what's best for her? I mean, I know that you lay out the menopause hormone therapy, you lay out the holistic lifestyle solutions. All of that is available at your clinic. There's so much to pick and choose from. And I know there's a lot of sometimes fear, sometimes shame or judgment for going the medical route or
Mhm.
going just the natural route. There's fear on both sides, right? How do we make the best decision for ourselves?
The best decision is going to be the one that you feel most comfortable with. So, in essence, that comes down to the conversation that you have with your healthcare provider and what options they're able to provide for you. I even just said this today to a few patients that I saw earlier is my goal or my hope is that I'm still able to present a plethora of options for women as they're going through any circumstance. It really becomes more difficult when you run out of options. And I would say most women are unaware of how many options that they have
Mm,
when it comes to Eastern philosophy and modalities versus HRT. When you think about the WHI study, which was done in the early 2000s, and what kind of havoc that wreaked on the ability for people to not even consider HRT as an option, we're just coming out of that. And that's like what, 20 plus years since the WHI study came out. And so I still have patients who come to me and are like, absolutely, I cannot take hormones. It's going to give me breast cancer. And so there needs to be a lot of education and awareness on pulling that messaging apart and helping empower women to understand really the benefit of HRT. And even in that conversation of understanding the benefit, even in the end, if you're like, you know what, I still don't want to take it, at least we were able to have a really good dialogue on what it is, why it's helpful, and if it's something that they would consider taking.
I definitely feel like just a sense of relief at hearing you speak because, yeah, you hone in on this fact that there are so many options available to us. I feel right now where the conversation lies, it's like either or, as I mentioned before.
Right.
And there's just a whole range of options. And that's can feel so liberating to so many women, right? It doesn't
Yeah.
mean that you just have to go this way, that you can have a menu of different options
Mhm.
and you can change the courses, you can change what's on the menu given how your own comfort level and the efficacy of what you're trying. There's always room to pause and
Mhm.
pivot and perhaps try
Mhm.
something else, right?
I mean, I think that's what life is all about, right? Is you're never going in there to only have an hammer as the tool, and that's
Mm,
something that you can use. I do believe a robust toolbox is what everyone needs because at some point in someone's life, they're going to need something else. And you have the ability to either limit that or be accepting to it and moving with the fluidity of what your life can be and not really giving yourself only one circumstance and how you can actually live that life. You have the ability to do that. And I think, when I watch your content and how you speak, I think that you personify, someone who's going through this and that's their experience, and also being open to some of the other things that might allow you to gain kind of like this perspective or beat a symptom if it was like hounding you down.
mm,
There are other ways to do that, but you have to be open to it. And I'm glad that
mhm,
you present yourself in the way of sharing with others, "Hey, have you tried this? Did you know this?" And I think
mm.
that's all the conversations, whether it's in an exam room, whether it's at the bar for happy hour, whether it's on the couch with your girlfriends, these are the discussions we need to be having.
Yeah, thank you so much for that. And yeah, I always say there's so much learning and unlearning to do in this space, isn't there? For the mere fact that, there has been so little research and funding invested in women's health and reproductive health. And so we're doing so much of that unlearning. And then there's so much new evidence coming out all of the time because slowly but surely there is research being directed to midlife women's health. And so we're discovering new things all the time. And so I always say the process is nonlinear, right? You
Yes.
can't just say, this is the only path I'm going to take and I'm going to hold on to that path for dear life. It has to be nonlinear. Like you say, it has to be fluid. And there's this sense of acceptance that, yes, that's how life is, isn't it?
It is, and that's what I think should be the beauty of life. I think I have come across a lot of people who are rigid in the sense that they want something to work, and that's the only thing that's gonna work for a long term. But I think even in the way we think about ourselves, I mean, our life where we were at 20 is completely different to where we are in our 40s, 50s, and thereafter. And so it should be the same approach when you think of internally what your body is doing in the aging process, and not looking at aging as something that is horrific, but rather being empowered by the fact that you have the luxury of aging, right? Isn't that a
Mhm.
beautiful way to look at it, as saying, I have the ability to age. I'm still here. How would I like to do that? And what are the best tools I can give myself to just to be the best version of myself at every point of my life?
And knowing that you have agency and choice every step of the way. That's so beautiful. Thank you so much for that. I want to change gears here a bit because our emotional wellness impacts our overall health and well-being and sexual health as well. What are the top three concerns women talk to you about when it comes to sexual health?
When we talk about sexuality, and the most common, I guess you could say, complaints or symptoms that women have is basically libido. Libido is decreased. And to me, libido is different than the ability to physically have intimacy or intercourse. It's that desire, that notion that you are aroused and would like to enter into a space that's intimate. And that, namely, is with the decline of testosterone. And we have testosterone. Women have testosterone. It's actually one of our most potent hormones, but we just have a very decreased amount compared to men. And then, in addition to that, is now the physiologic aspect of what happens during menopause, which is vaginal dryness. And that has to do with the decrease in estrogen and how it impacts our tissue, namely in the vaginal canal, which then leads to decreased lubrication, decreased blood flow to the area, decrease in collagen, which does not allow for the expansiveness of the vagina to be accommodating, and then also for just irritation. And so all of these things combined, I think women really come to me with these complaints, and those would be the two. And then with vaginal dryness, we talked about testosterone, but vaginal dryness is usually going to be an impact from decreased estrogen. Okay, so you have all these different changes that occur physiologically, but then also emotionally, which we would call that decreased libido.
And I know a lot of these symptoms, this constellation of symptoms that you're talking about, can be so distressing. They
Mhm.
can be so painful. They can also be so embarrassing, right?
Yeah.
I think you may have mentioned urinary incontinence
Mhm.
or frequent UTIs. How would you advise our listeners to broach this topic with their providers? Because I know part of the hesitancy with getting support for this is just knowing how and when to talk about it with a provider who is willing to listen like you are.
Yeah, I think that's where you start to see some of the ability to change who our provider is. And I think, we come from a history of where your relationship with your physician is one that's very respected, very honest, and one of loyalty. But, I don't think any doctor should be offended if their, patient is not getting what they need out of their relationship and moving to another physician and or healthcare provider. And when we think specifically about menopause, obviously we have seen that it's discussed more, whether that's social media or in the news or articles, and with menopause experts being the provider. But that doesn't mean that everyone knows everything about menopause. And so I think that as you're starting to go through these changes, if you feel that the conversation that you're having with your provider is not one that's really getting you to move to the next step, then that's okay to find a provider, which now you have various ways of doing that. So, for example, going to NAMS and finding maybe a local menopause trained physician is helpful. And then you have telehealth platforms as well, which are really devoted to menopause and making sure that women get their initial, if not more than their first and second or third, management through the menopause and perimenopausal phase. And that's grown significantly as well, because before it was, you only can get what your provider information your provider gives you. And now we have outlets as well. So I think that's fascinating and is only going to help decrease kind of the suffering that we've seen in women when they go through menopause.
And your clinic offers a very unique and innovative way of supporting women. Sanctum Med and Wellness is a concierge service. What can you talk to us more what that concierge service looks like and what exactly you offer women who come to your clinic?
So, because I focus mainly on menopause and sexual health, it was something that obviously I don't think the system really has the capability to conceptualize what that care looks like. And so what we do in concierge is obviously we don't have insurance coverage. And you can do that in two different forms. You can do it based on visit. You can, do your a la carte visits and how you'd like to experience the options that are given for you individually during menopause. Or we do love when patients do the membership. And the reason why I focus on the membership is because you don't only get my expertise, you get the expertise of the other providers in all the other different modalities who are going to help you through this process, namely our Eastern medicine doctor, our traditional Chinese medicine doctor, who focuses on acupuncture, herbs, and the ability to assess you through a different form of medicine in Eastern medicine than I can ever do. I'm not an acupuncturist. So I think that having that expert being able to assess from a different lens is important. And then also, again, we discussed that we have the two life coaches who are really phenomenal and are women who have gone through and are going through these experiences as well, but look at life coaching through a different perspective. And then we have two licensed therapists for those who really maybe might having those severe anxiety or depression moments. We have two licensed therapists, and then we have a registered dietitian. If I can't say this enough, I really believe that nutrition is one of the fundamental pillars of medicine, and also through the menopausal phase where you see a complete shift metabolically in how your body uses, stores, and presents energy in the form of food, right? So we have to change how we look at food and what we use to fuel our body. And so we focus on that. And then we also have a massage therapist, a stretch therapist, a physical therapist, which is very helpful, especially as women start to have more joint pain. And then last but not least, we have our yoga instructors and vibrational sound bath. So, and also a skin specialist as well.
I
So
think I
through
might have to relocate to Dallas, Dr.
I
Shepherd.
think I think you're gonna have to, like, starting, like, next month. These are all the things if you think about your life and all the changes that, come with it, why would I expect one person to keep account of it at all times as it starts to happen? And so that's why we really created a team that you can get the expert who's the expert in it. You have one place to go, so you don't have to be shuttled all over the place and a referral sent here or there. And then truly, we're looking at you holistically from a Western medicine, evidence-based medicine perspective, but also all these beautiful ways for you to integrate into your life as you start to go through this menopausal journey. And that's important because 40% of your life will be spent in the postmenopausal phase. So why would you give up on yourself so early and not adapt to some of the things that can help you present in this 40% of your life that's going to be lived in this phase in a way that's beautiful rather than in disparity and needing all of these different things, but you just keep missing the ball. And I find that then you're playing catch up, right? You're playing catch up to something that was already bound to happened, and now you're trying to play catch up, which I honestly feel is sometimes what we do too much in Western medicine is we wait for you to present with the thing before we actually start to address it. Whereas prevention to me is always the best way.
And this is all under one roof, right?
Yeah.
All under one center, your center. And I think that is such a beautiful way to approach our health. And what better gift can you give yourself, right? In terms of how you're going to manage the second half of your life, the health. If you're focused on health and longevity and wellness and living your best life, really taking that beautiful holistic approach, I think is the future of medicine. And I'm so grateful that you offer this. Thank you so much for that.
Absolutely. I love doing it. It's almost like it was a love letter to women's health when I started
Mm.
them because I really wanted my patients to see themselves in a different light rather than coming to see me every time there was a problem or begrudgingly because it was their annual and they were getting their speculum exam. I want them to see themselves physically and also emotionally in a different light.
So beautiful. Thank you so much for that. I wanted to move on to talk about the experiences of women of color. You're a Black woman. I'm Latina. We know that women of color experience menopause differently, especially Black women and Latinas. And then, so for our listeners who fit into these groups, what can you tell them in terms of preparing for menopause? How is it different for them? And what should they be looking out for in terms of better preparing themselves for the menopause transition?
Yeah, the menopause transition really does present differently for people in the Black and Brown communities. And so, for Black and Hispanic women, I think it's important that they too know that their experience may be different. I'm not saying that all of it will be different, but most likely you will see some differences in how they experience menopause. And that has to do with they noticed that it was measurably earlier than their white counterparts as far as when they started to feel some of these changes and start to going through the actual menopause transition. And then in addition to that, hot flashes. So there's one of the pivotal studies that was done. It's called the SWAN study. And what they looked for specifically is what is that experience by ethnicity? And they looked at Japanese, Chinese, Caucasian, Hispanic and Black women when it came to hot flashes, right? And they wanted to see for women who were having hot flashes, one, they started earlier, but two, they noticed that they were going over a longer time frame of average in years of how long they were going to experience hot flashes and also more severe. So when you look at that, again, that's like a powerful influence in how people can empower themselves to say, well, if it's possible that it may be longer for me and how what I'm going to experience with this certain symptom is that I may want to address it earlier than possible so I don't have to go through 7 to 12 years of having hot flashes. And so I think it's important that even for healthcare providers, when they look at statistics like this or they see outcomes like this, is to be able to use that in their practice when they have a diverse patient population. And how can I express this information to the women that come and see me based on their ethnicity? And so I think that that is one of the kind of best ways that you could look at a study because it is actually using stratification of ethnicity to say, what are we going to get out of this?
I think if I can just add a little bit of my own personal experience, I didn't know that for Latinas or for Latin American populations, there is a greater propensity for blood sugar dysregulation, for type 2 diabetes, looking at that. And I thought I was doing all the right things, managing my diet, exercise. And it wasn't until just after menopause that I started seeing huge changes in my HbA1c levels and not really knowing that, okay, this is something that maybe I'm more prone to because of genetics, because of ethnicity. And it was never really flagged to me. I mean, so I didn't make the necessary adjustments to that. I came to you and spoke to you about it, and you helped me look at different options, which I really appreciated. I was afraid of any kind of medication, but you let me see that, okay, you're doing the right things in lifestyle, but then, you can also add something like metformin, which has
Right.
shown to be beneficial, not harmful. And there's a way to approach some of these issues that we have if we have a propensity genetically, certain metabolic issues like
Mhm.
cholesterol or diabetes, we sometimes have to take that two-pronged holistic and medical approach, don't we?
Exactly. Exactly. And so those are the things that are important, one, from a research perspective, but also important for actual women to know what this transition is going to look like.
And why do we have in menopause that dysregulation in blood sugar and cholesterol? I think that's the more women that I talk to, I see that those are some of the issues that are also coming up for them.
Yeah, so there's an intricate balance, I guess you could say, or intricate relationship when we think of hormones. They're kind of like part of a family, right? So it's like a distant cousin, an aunt, and an uncle. But what we really see is metabolically estrogen receptors. Again, we name that they're all over the body, but where they're located, say on muscle. Right. So you lose a lot of your lean muscle mass during this phase, and there's estrogen receptors on your muscle as well. But that's one of the ways. There are a few more modalities in how this happens, or mechanisms rather. But glucose, when we eat it, or it's our source of energy, comes into the body, the muscle is one of the largest utilizers of glucose. So if you have a decrease in your muscle mass, and then you also have a delicate shift in the balance between how insulin is able to shuttle glucose, where it's able to store it in the liver, et cetera. That is a little off as well. And so when you start to see all of those changes, then one, the thing that uptakes glucose can't do it as well anymore. And so then you also have a shift in how the insulin moves glucose. So it sits in your system, I guess you could say, is the easy way to say it. It sits in your system for a longer amount of time, which again goes to what am I going to do with it and what's it going to do when it's sitting around a little bit more. And that's when you start to see those subtle changes in your glucose. And namely, you'd mentioned it before, your hemoglobin A1C.
Mhm,
That again
mhm,
is going to kind of like push your body to becoming a little bit more insulin resistant and less insulin sensitive. And from that, that's when you start to get some of those changes in
mm.
your ratios.
And I found that taking that holistic approach is so, so important that,
Mhm.
you need to call in all the
Yeah.
tools and really be very dedicated and diligent in adhering to them. It's not just, okay, I'll try it for a month and see what happens. You really just have to be very, very consistent. And
Yeah.
it can be slow going, right? It doesn't happen
Mhm.
overnight. I want to go on and talk about your book,
Yeah.
Generation M. I'm so excited for you. What can we expect to learn from Generation M?
Yeah, Generation M to me is that girlfriend's book where I want it to be like a work of art in the sense of it's something that you would have out on your coffee table because it presents menopause in a way where it's a lifestyle rather than a condition. It presents menopause in a way where someone who's perimenopausal can read it and be feel empowered because now they've gained some insight into what's coming, but also the things that they can do to get them to prepare. And then I also feel like it's a sisterhood in the sense where I had a lot of friends, namely you, Gabriella, and also experts give their expertise and also experiences so that it wasn't just something that was like coming from me. And, yeah, I know a lot about menopause and I know what each of the hormones are doing, but I wanted women to see themselves in others. And that's one of the most beautiful ways that someone can not feel isolated or like they're on an island is that they're like, other women are going through this, and her experience was so similar to mine. And now I have actually the tool, because it's listed in the book, on what do I need to do in order to feel better about myself, but also to feel better overall. And then I brought in a host of like amazing friends and experts that I've worked with over the years, a registered dietitian who owns a company in New York and really works with women on that part of their life. I brought in a sex therapist, one of my really good
Mhm.
friends, Dr. Nan Wise. And then I also brought in like a bone specialist. And I also brought in one of my favorites. She is OBGYN trained, but she's also PhD and she is a mindfulness instructor and a meditation instructor. And when I first met her, I was just floored at the way she was able to use meditation as a tool to help mitigate anxiety, depression, but also pain. And I think that together, I'm always big on collaboration together through what they're able to offer, through the stories that women were able to offer. We provide a community in the form of a book. And to me, it's just a piece of art.
I love that. I always say that we cannot menopause alone, that we need
Yeah.
the village to go through it. And I definitely think you're going to provide that with this beautiful work of art. So tell us, when can we expect it to be
Yeah.
out into the world?
So we are on like our final post edit of print and what that looks like as far as in the book and the cover. We're actually like finalizing the cover over the next week or two. And it's going to be released in October, which of course is month, right?
Mm-hmm.
And so I'm just really getting ready for that because we're going to start to do things like city tours and visits prior to pre-launch. And then also obviously throughout the month of October, we'll be going hot and heavy there.
So, so exciting. You know, I'm going to be here to cheer you on.
Hot, no pun intended, right?
So I'm so, so excited
Austin
for you.
Austin is one of those stops that's
Yes.
definitely gonna be on that book tour.
We're going to be waiting for you with open arms, Dr. Shepherd.
Thank
So
you.
we are nearing the end of our conversation. I would like to pause and just ask you something that I ask all my guests, and that is just to reflect and share with us what brings you pleasure, Dr. Shepherd.
Oh, what brings me pleasure? What brings me pleasure is the ability to sit with myself and understand in that moment of being present, what are the things that have gotten me there? What are the things that allow me to reflect in a way that I feel good about myself? And then also, what are the things that I'm going to do to contribute to the legacy of my health? I'm very on wellness and what I would like my life to look like, meaning how I want to present as I age. And I think that there's so much that's available to us if we were just able to use our senses and look around and smell and see and be present, that we would have all of these tools available to us to be our best selves. And I really hope that I can encourage people to do that.
Thank you so much. That's so beautiful. I love that reflection of recognizing how far you've come, and where you are now, and where are you moving? What are you moving towards? And how do you want that to look like? And it can be such a beautiful, beautiful journey with
Yeah.
the right tools, with the right community. And thank you for being here with us today. It's been such a huge pleasure. I want to thank our listeners for saying yes to pleasure and joining us today. And I hope that your biggest takeaway from today is that your body, your health, and your pleasure matters. Before we say goodbye, I want to remind you that Dr. Shepherd's book, Generation M, is now available for pre-order on Amazon before its release on October 1st in time for World Menopause Awareness Month. You can connect with Dr. Shepherd on Instagram at modernmeno and at Jessica Shepherd MD. I hope you enjoyed this episode of Pleasure in the Pause. Want to help me spread more pleasure in the world? Hit the share episode button and send it to a friend or post it on your Instagram stories and tag me, Gabriella Espinosa. And if you really love this podcast, please leave a rating or review, as this helps the show get in front of new listeners. Finally, if you would like to access even more pleasure and stay in touch, sign up for my free Pleasure Upgrade Bundle of powerful mind-body practices by going to pleasureinthepause.com. Remember, your pleasure matters.